Hi everyone, welcome to week 12 of our class. This week we'll be talking about a select few global health issues. We'll be covering antibiotic resistance, mental health, climate change, and discrimination. There are a lot of other global health issues that we could discuss, but these are a few that I've chosen to focus on for this week. Getting started with the topic of antibiotic resistance, first it's important that we understand what antibiotic-resistant pathogens are. These are microorganisms like bacteria that cannot be killed with existing antibiotics that we have in the medical field or other treatments. Unfortunately, infection with antibiotic-resistant pathogens or ARPs, it can be life-threatening, can cause disabilities, and in some cases can actually lead to death. These infections can be lethal. I think there's a lot of misinformation out there about antibiotic resistance. We all have probably heard this term, so let's talk a little bit about what this reality looks like, how antibiotic resistance works, and some of the things that we can do about it. Antibiotic resistance is caused by a lot of different things, but misuse and abuse of antibiotics is one of the primary contributors. Using too weak of courses of antibiotics or too long of courses of antibiotics, as well as not finishing the prescribed course of antibiotics, are all potential contributors to antibiotic resistance. The reason for this is bacteria and other microorganisms can essentially learn how to evade or become immune themselves to those antibiotics. Those medications can become ineffective over time, especially in the cases of misuse or abuse of antibiotics, using antibiotics for non-bacterial infections, like for viral infections, which antibiotics will not help with, or a lot of people might take, 5 out of 7 days of a course of antibiotics because they feel better. And then those remaining bacteria, those really strong ones that have not been yet killed off, can then continue to reproduce themselves. And then you end up with a bunch of stronger bacteria as that infection instead. Overall, the phenomenon of antibiotic resistance is an example of something that we call the tragedy of the commons in sociology. This is where individuals' self-interests lead to collective ruin, where essentially every person wants to use this resource for their own benefit, but the overuse of this resource can actually lead to the depletion of the resource overall or the reduction of its utility. Another example of a tragedy of the commons would be overfishing. Say if there's a pond and every single person in a town or a community is fishing for their own benefit, maybe not just to feed themselves, but to sell fish to other nearby communities. Eventually, that source of fish will be depleted. There may not be any fish left, and that pond therefore becomes useless to the community, or in other words, collective ruin is the result of those individual self-interests. When it comes to the ways that we use antibiotics and the impact that these different types of use have on antibiotic resistance, there are antibiotic abuse factors and antibiotic misuse factors. Antibiotic abuse looks like using antibiotics when they are not beneficial. So that previous example of using antibiotics for a viral infection, antibiotics typically are designed to kill bacterial infections or bacterial microorganisms. And so using antibiotics, say for like a common cold or the flu, will not be effective for that infection. That would be an example of antibiotic abuse. Antibiotic misuse is using antibiotics when they're not beneficial to the individual patient. So giving the wrong antibiotic, perhaps, if a person has an E. coli infection and an antibiotic that does not work for E. coli is prescribed, but they do still have a bacterial infection, that could be an example of antibiotic misuse, as well as using too long of a duration for treatment. We want kind of this Goldilocks happy medium where it's not too short and not too long of a duration when it comes to prescribing antibiotics. Too short or too long of a course of antibiotics can lead to antibiotic resistance, as those bacteria are either not killed off or they have too much time to learn to become immune to those medications. On the contrary to abuse and misuse, we have people who are antibiotic stewards, who are individuals who are neutral professionals helping to regulate antibiotic use. We see a lot of public health professionals and medical sociologists working in fields and working with medical institutions to try to regulate the overprescription of antibiotics and prevent that misuse through things like testing before prescribing antibiotics to make sure that the most effective prescription is being used for every individual infection. However, antibiotic stewards do bring up the concern of essentially who will steward the stewards, who will monitor that the professionals in those kinds of positions are doing the most effective and the most ethical kind of work. Because, of course, within the medical field, we always have the potential for conflicts of interest or people having their own personal biases towards or against different kinds of practices. So we need essentially checks and balances within the system and within the medical field to regulate our use of antibiotics and make sure that it's the most effective. The consequences of not using antibiotics effectively and appropriately are pretty serious. Potential consequences of antibiotic resistance growing in its prevalence are that we have the potential to eventually not have any effective antibiotics left. This could happen in the not so far off future if we continue the way that we have been going. We already have over 1 million deaths per year caused by bacterial resistant or resistant bacterial infections. That is a lot of individuals just in the United States alone, over 1 million deaths per year. We, of course, also have the economic burden of treating antibiotic resistant infections. These kinds of infections can be really aggressive and often can lead to hospitalization and long term disability. And so there is, of course, a lot of cost for the patients, but also for the medical sphere in supporting those patients. We do also see worldwide, when we look at this on a larger scale, that low and middle income countries are the most affected by antibiotic resistance. There's a little bit less antibiotic stewardship in certain regions around the world and potentially more abuse and misuse of antibiotics. That can, of course, lead to increased antibiotic resistance in those areas. And then finally, another potential consequence of antibiotic resistance is permanent disability as a result of having an infection. So the morbidity and mortality rates for antibiotic resistance are really high. This is something that is becoming increasingly more serious and concerning. And for a little bit of a personal touch on this topic, I actually myself have a permanent disability in the form of chronic pain due to an antibiotic resistant infection that I sustained a handful of years ago that led to nerve damage and a host of other organ function issues as a result of that infection. So the consequences of this phenomenon are really serious, and we're only seeing these problems increasing. Fortunately, there are some things that we can do as far as preventing antibiotic resistance or reducing the seriousness of these issues in the meantime. As individuals, we can use antibiotics responsibly. As prescribers or medical practitioners, we can prescribe antibiotics responsibly, and we can act as antibiotic stewards, whether we are healthcare professionals or otherwise. So it's really important that you yourself and the people in your life, if you can educate them on this topic, use antibiotics responsibly and effectively. If you're prescribed antibiotics, make sure that you finish the entire course of antibiotics. You never want to save any for later. If you, say, have an ear infection and you go in and you get a 7-day course of antibiotics, make sure that you take all 7 days of those antibiotics to have the best chances of killing all of that bacteria and not leaving behind those, essentially extra strong bacteria that withstood the first 5 or 6 days of antibiotics. It's also important that the medical field researches the most effective antibiotic types. We can look at different strengths of antibiotics as far as what is in each individual pill. We can also research different course lengths. So we can see for a particular bacteria, how long and how strong of a dose do we need to kill this kind of infection effectively. Of course, we do also need to develop new treatments because of all of the antibiotic misuse and abuse that's happening. Over time, unfortunately, our current treatments will become less and less effective as we get more so-called superbugs or these antibiotic-resistant pathogens floating around in our atmosphere and just present within our world. We do need to develop new treatments to tackle those kind of superbugs and make sure that we have effective treatments to deal with antibiotic resistance. Next up, we're going to switch gears a little bit and talk about another global health issue, mental health. Mental health and mental illness are widespread issues around the globe. We do know that about 12.5% or 1 in 8 people globally have some kind of mental health diagnosis or mental disorder. Coming from the International Classification of Diseases, we can define a mental disorder as characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. It's usually associated with distress or impairment in important areas of functioning. The most common mental disorders are anxiety and depression, but there are a host of other different kinds of diagnoses. When it comes to understanding mental health and mental illness, we have to understand that these are biopsychosocial phenomena. So breaking that word into its three parts, bio refers to biology. So we're looking at genetics of individual people, neurochemistry, the kinds of chemicals and the amounts of each chemical that a person has in their brain, as well as brain structures. Certain parts of the brain anatomy can affect a person's mental health outcomes, depending on whether they have more or less matter or mass in certain areas of the brain. Coming to the second part of biopsychosocial, talking about psycho, that is the prefix of psychology. So when we're looking at the psychology of mental health, we're looking at a person's cognitions, the types of thoughts that they're having, their pessimism, their optimism, thinking patterns, and coping skills. Coping skills being kind of how a person deals with day-to-day life, especially dealing with challenges. The social aspect of biopsychosocial, here we're looking at society and culture. So that's how things kind of outside of the individual may be affecting them, or in tandem with the individual. So this can be things like the economy, the state of the economy, the interpersonal relationships that that person has, their employment status, their income, their socioeconomic status, and their experiences of structural inequality or inequity. It's the combination of all of these factors, the bio, psycho, and social factors, that lead to a person's particular individual mental health status. Mental health and mental illness show up in a lot of different ways for every individual person and group, culture, and society. But a few examples of mental health in especially the last few years that we've been looking at are that people who are exposed to adverse circumstances, things like discrimination, poverty, violence, people with disabilities, and people experiencing a lot of inequity or inequality, these groups and populations are at a higher risk for mental disorders or for developing mental health struggles. During the COVID-19 pandemic, we saw a huge increase in mental health struggles. Anxiety rates amongst the population went up 26%. Depression went up 28% in prevalence. And so it's very clear that these are important issues for us to be studying, for us to be concerned about in modern times. There are a lot of different factors that lead to mental health struggles. They can be very individual, they can be more sociocultural. It can, of course, always be a combination of those factors as well. And so medical sociologists were very interested in this topic and, more importantly, how we can help people who are dealing with mental health struggles. When it comes to getting mental health treatment, if you or anyone that you know is dealing with those mental health problems or struggles, it's not always easy to access treatment, but there are a lot of options out there. For a lot of people, though, what this reality looks like and what sociologists are very concerned about is that treatment cannot always be affordable, is not always high quality, and sometimes is not nearby to people who are seeking it. Only about a third of people with depression receive formal care, about 33% or 1 in 3 individuals. That means that 2 out of every 3 people with depression is not receiving formal care or treatment to be able to help them with that mental health. Luckily, there are a lot of online resources that are becoming more common. There are a lot of virtual therapy options, text therapy, phone calls, video calls. These are becoming more common and more accessible for a lot of people. Unfortunately, this does not apply to individuals who don't have technology access or who don't have perhaps internet access. But further beyond that, there's also a lot of options for self-treatment and self-care in the mental health sphere. A combination of different kinds of approaches can be really important, and professional help is very valuable, but we do have to acknowledge that it's not available or accessible or affordable for every single person, and it's not always the best solution for every situation. A few tips that I have for all of you. Part of my background, I was a therapist for about 5 years, specializing in trauma therapy and self-care, working with particularly individuals with disabilities. So this is something that I'm really passionate about. A few things that you can do to kind of care for your own mental health. You can use professional resources if you have access to them. There are a lot of reasons why they're difficult to access, but if you do have that option, I do urge you to take advantage of that. It's also important to be mindful of your stress levels. Try to avoid getting to those really, really high stress levels. Of course, this is easier said than done, but being mindful, right? Trying to keep an eye on your stress levels. And if you notice them getting really high, um, thinking about ways that you can cope in a healthy way and kind of reduce that stress naturally or by perhaps changing things in your environment. You can also work on challenging negative cognitions if you're noticing a lot of pessimistic thought patterns. Um, this is something that comes hand in hand with cognitive behavioral therapy. You can kind of retrain yourself to think differently about situations. We talked a little bit about shift and persist in a previous lecture about socioeconomic status of health. Um, this is really, really applicable to mental health, changing those negative cognitions and practicing new ways of thinking about your situation can make a really big difference. Of course, making environmental changes if you can, whether that's not associating with people who are making your life more difficult, changing your job if your job is really difficult for you or causing a lot of stress, changing your habits, changing your cognitions, even small things like cleaning up your environment and doing the dishes or doing laundry. All of that can be really difficult to do for a lot of reasons, but those environmental changes can have a really big impact as well. It's also important to self-advocate. In a lot of situations, mental health is stigmatized, mental health is misunderstood. So especially in medical contexts and employment contexts, advocating for yourself and asking for your needs to be met or for accommodations, that can make a huge, huge difference. Caring for your physical health as well can really impact your mental health. Whatever that looks like for you, whether it's certain types of exercise or potentially different kinds of diet changes or just staying hydrated, making sure you get enough sleep, all of those kinds of things for your physical health are really tied up with your mental health as well. And finally, the people in your life make a huge difference for your mental health. If you can, surrounding yourself with positive relationships and supportive, caring people, that can make a huge, huge difference for your mental health. These are just a few tips. This is not professional advice. You can Google a whole bunch of different resources to care for your mental health as well, but definitely just something to be thinking about. We talk a lot in this class about all of these big picture sociocultural things, but I think it's important to connect back to yourself and really see yourself in the content that we're talking about as well, because we are all humans with different levels of health, different levels of illness, and different experiences. So these things do affect us all very individually. Next up, we will talk a little bit more about another global health issue, climate change. So climate change, we can define this as long-term shifts in temperatures and weather patterns. This is a global phenomenon, hence talking about this as a global health issue. This is something that we have been seeing since about the 1800s. About 200 years ago, human activities have been a huge driver for climate change, or sometimes this is also called global warming. And this primarily is due to the burning of fossil fuels, things like coal, gas, and oil, that can produce heat trapping gases, which get stuck in our environment and kind of keep the heat on the Earth from escaping the Earth's atmosphere. This leads to the global warming or the warming up of the globe. in a way that changes those shifts in temperature and those weather patterns. You may be wondering, how on earth is climate change a global health emergency? Climate change leads directly to acute hazards. These are things like hurricanes, floods, wildfires, those kind of natural disasters, as well as ecosystem changes, food and water insecurity, especially in island regions or places that are close to the ocean, as well as a loss of place and culture for people who are displaced or whose homes and regions are destroyed by these kinds of hazards and changes. Things like droughts, natural disasters, crop failure, mosquito breeding grounds, contaminated water, malnutrition, food scarcity, and forced migration. All of these things are huge health hazards. There's also a huge lack globally for adequate mental health care. So as people are dealing with these kinds of hazards, especially things like loss of place or forced migration, wildfires, getting rid of entire communities, leveling entire neighborhoods or cities, this kind of thing, of course, leads to a very difficult mental health space, can lead to significant trauma, is just really, really difficult for individuals to deal with and for communities to deal with. And so all of these different effects of climate change are quite obviously a huge global health emergency. We, of course, also are dealing with the mental health impact of climate change as far as fear and anxiety about these changes and kind of what this is going to look like going forward. Some of the terms that we have for this concept is climate change anxiety, eco-anxiety, ecological grief, or solastalgia. All of these kind of describe the same thing, but that mental health impact of living in this changing world, this changing environment. I have here a little infographic on, again, how climate change affects different parts of human health and different communities. We have, of course, the direct health impact of things like chronic disease, disability, mental health issues, but we also see changes in the socioeconomic sphere. We see a lot of poverty, especially impoverished areas near the ocean, being very significantly impacted. We also see geographic areas that are dealing with water insecurity, these extreme weather events or natural disasters, differences in who's being affected as far as the demographics of communities that are being the most negatively impacted right now, and socio-political factors as far as political instability, displaced populations and refugees, a lot of climate refugees that are dealing with rejection from the places that they are seeking asylum, and just a lot of issues that are all very interrelated here. This is unfortunately a very complex issue. It's not something that's a simple kind of solution, but there are luckily a handful of solutions that we can kind of start to work with, and that a lot of people are already working with to try to alleviate some of these struggles. Three primary solutions that were discussed in our reading for this week as far as climate change as a mental health emergency. First, we can integrate climate change concerns into our policies and programs that deal with mental health so that we can better prepare for and respond to the climate crisis as this crisis grows. Disaster risk management, or DRM, and disaster risk reduction, DRR, can help to reduce suffering in the moment during instances of climate emergency or natural disasters. But of course, we need long-term solutions as well. We have to tackle mental health and the climate crisis together. These are so interrelated that we cannot just be using Band-Aid solutions. We need to plan ahead with policies and programs to deal with both the climate crisis and mental health together. Second, we can integrate mental health and psychosocial support within our policies and programs dealing with climate change and health. We can use mitigation efforts, things like public transit, ease of access to transport, incorporating green spaces when we do our urban design, and working for stress reduction techniques within local communities and larger communities. We can also use adaptation techniques like strengthening our climate resilience within health systems, bolstering those healthcare infrastructure and healthcare providers, making sure that they are able to deal with these kinds of emergencies and provide effective support. And we need to include mental health in those health systems instead of keeping it so separate from physical or physiological health. Third, we can build upon global commitments, things like the Paris Agreement. That is a legally binding multi-country treaty that aims to limit global warming to under 2 degrees Celsius or 1.5 degrees per year. We also have things like the Sendai Framework for DRR, disaster risk reduction. Straight from our reading this week, this is looking at how a lot of disasters or climate change issues are exacerbated because of these just larger scale problems. These disasters are increasing in frequency and intensity. We're seeing a lot of climate disasters recently, and that is hindering progress towards sustainable development across the globe, both just economically and within the healthcare sphere. So we do have some larger scale solutions to the climate change, mental health, and physical health emergency. But again, this is a really complex issue, and it is not up to any individual or any small group or community to solve. A lot of the reasons why we're seeing such intense quickening climate change is because of just massive corporations and the use of fossil fuels, the use of all of these unsustainable and non-green practices that is just really contributing to this massive growth and acceleration of these problems. So if you're feeling that eco-anxiety, again, it's not an individual choice, it's not an individual effort to solve these problems. This is, you know, at the scale of nations, massive corporations, entire governments. There is a lot of action that can only be taken by these huge conglomerates to kind of start to influence those larger issues that are contributing to climate change. Switching gears, up next, we're going to talk a little bit about discrimination as a global health issue as well. Before we jump into that discussion of discrimination, though, there are two more solutions that we can discuss for climate change and our global health emergency in relation to climate change. We can implement multi-sectoral and community-based approaches to reduce vulnerabilities and address the mental health and the psychosocial impacts of climate change. In doing this, it's really crucial that community organizing and external aid are really bolstered, really strong. We can build on community resources when disasters happen, especially starting with external aid and just adding to any of those existing community resources. The people in a community, when a natural disaster happens or a climate disaster happens, they're not just passively receiving external aid. People come together and they work together with their neighbors, with their community, and then that external aid can add to what those individuals are already doing in those kinds of emergency situations. We do need to make sure that that external aid is really strong and that we can reduce those vulnerabilities or those gaps in external aid. We also have to address the really large funding gaps for mental health. This is a global issue. There are about only 2.1% of health budgets spent on mental health in governments worldwide. And so to respond to the health impacts of climate change, it's important that we increase the funding for mental health. We increase the funding for a focus on all of the climate-related issues that we're going to continue to see as this issue progresses. Moving forward to discuss discrimination in health, we're going to do a little bit of a deep dive into the topic of eugenics. So eugenics, unfortunately, is not just something that happened historically. This is not a relic of the past. Eugenics is something that we still see happening today. And we can define eugenics as the practice of artificially changing the makeup of the human population with the goal of creating a population of people with so-called desirable traits. Also, reducing the amount of people in the population who have so-called undesirable traits. There are two categories of eugenics that we need to understand. There is positive and negative eugenics. This is not a value or moral judgment in these definitions. This is more kind of like math, positive being adding, negative being subtracting. Positive eugenics is the selective or the selection of desirable traits to be passed down to future generations. So increasing the number of people with so-called desirable traits in the population, adding to the population people with these so-called desirable traits. Negative eugenics is the erasure or the prevention of undesirable traits in the population. So subtracting the number of people with so-called undesirable traits, perhaps preventing people from being born through things like prenatal genetic testing, or for the more violent kinds of examples, we could see eugenics coming through or being carried out in the form of genocide. The history of eugenics goes back for centuries. This goes back all the way to Plato, who said that only people with so-called desirable qualities should reproduce. These kinds of ideas have been around for a very long time. In the 1800s, Darwin's cousin Francis Galton actually coined the term eugenics in 1883. That prefix of EU means good, and genic means producing or pertaining to generation. So kind of the good production or the shaping of society or the population in a way that is seen as good. Um, of course, the beliefs about what is good or what is desirable is very sociocultural, very dependent on the individual's perspective. Unfortunately, we see a lot of examples of these kinds of ideas, and particularly those in power deciding, again, who is good or who is desirable. We see a lot of examples of government and people in power taking part in eugenics, having these kinds of ideologies, and engaging in things like genocide. People who are targeted most often by genocidal practices are going to be disenfranchised groups, oppressed groups, individuals who are not afforded a lot of rights or opportunities or resources within a community. Um, and there are just countless examples of this. We're all very familiar with some hugely famous historical examples such as the Holocaust, but there are a lot of examples of eugenics and of genocide that we can discuss. A handful of examples, and of course this is not an exhaustive list, would be the residential schools in the US and Canada for Indigenous children from like the mid 1800s to the mid 1900s, the immigration control taking place at Ellis Island in the United States, again, about from the late 1800s into the early 1900s, kind of that Victorian era of time. We also had in the United States a eugenics records office in the early 1900s. This was an office that kept essentially pedigrees on paper of several families or most people around the United States, kind of tracking who had the so-called most desirable genetics or family lines. From the early 1900s also until today, we've seen camps or essentially concentration camps at the US-Mexico border and a lot of really xenophobic anti-immigration policies, a lot of very punitive measures directed towards individuals, especially coming from Central and South America. During the World War II era, we also saw the Nazi T4 program and then the Holocaust. For anyone who's not familiar with the T4 program, this was leading up to the establishment of death camps in the Holocaust. This was where disabled individuals in particular were targeted in care homes by the government in Germany to essentially eradicate or commit genocide towards those individuals. A lot of disabled people were essentially guinea pigs for the chemicals and the means that people were going to be killed with later in the Holocaust. They were testing different kinds of injections on this population, killing people in a variety of different ways, and then lying to their families, saying that within the care homes that these disabled people were housed in, that there were highly contagious diseases spreading, things like flus. That meant that those individuals' loved ones could not come see their body, could not come to the space where these atrocities were happening. Um, this is something that's not talked about very often, but that's a great example of disability eugenics or genocide towards disabled individuals. And again, that was a precursor to all of the other atrocities of the Holocaust. In the United States, again, up until 1967, we had anti-miscegenation laws. These were laws that prohibited interracial marriages or relationships, and particularly having children between people of different races. That was an attempt to control the amount of people of color in the population and to oppress and separate people um, based on racial identity. We saw the Rwandan genocide of Tutsi people in Rwanda in 1994. In 2019, up until now, we also saw some very eugenic triaging practices or medical rationing practices, particularly directed towards disabled people during the pandemic. We also have IVF, in vitro fertilization, prenatal genetic testing, and the genetic alteration of human embryos to create so-called designer babies and really select those so-called desirable traits for babies who are not yet even going to be born. And we also currently are seeing a genocide taking place in China amongst a certain population of Muslim individuals. I unfortunately do not want to butcher the pronunciation of this community, but individuals are being put into concentration camps and, quote, re-educated and essentially tortured in these kinds of camps, even right now, today, in China. So there are a lot of real world examples of eugenics. Again, this is not an exhaustive list. You are free to Google any of these things, learn more about any of these instances, or reach out if you have any questions or want to learn more. This is a really dark part of human history. It's difficult to talk about, but it's really important that we look at these examples so that we can understand how discrimination and hateful ideologies lead to these really large scale, just absolutely traumatic, horrible, horrible kinds of experiences and instances. When it comes to, again, this distinction of desirable or undesirable traits, we want to look at, who is making these distinctions and why. Eugenics as a practice, it aims to increase the people who have those desirable traits and decrease the people who have those undesirable traits. And this is done in a lot of different ways. Of course, genocide and the actual killing of individuals is one of those really horrible examples. But we also see examples of things like intelligence testing as a potential eugenics practice. IQ testing in general is a very problematic issue. There's a lot of racism and a lot of assumptions built into IQ testing and intelligence testing in general, which leads to the devaluation of certain groups and this valuation of people based off of things like IQ in a way that just really shows that certain people can be very dismissed and dehumanized based off of even just the number. We also have in the United States a long history of forced sterilization, particularly against women of color and people with disabilities. A lot of the time, especially in asylums in like the Victorian era and earlier, people were being put under and going through surgeries that they didn't necessarily know what was happening to them. They would wake up from surgery and perhaps be told that they had something wrong and they had actually been sterilized against their will and without their knowledge. This was, of course, a direct effort to try to reduce the number of people with these so-called undesirable traits. So a lot of people of color and a lot of disabled people were targeted in those instances. We also, still today, but through all of the United States history, have had examples of really strict immigration policies for people of color, the racialization and the devaluation of non-white groups, and things like quotas for people coming from certain countries rather than others. I think a great example of this and just American xenophobia in general is the fact that out of the undocumented immigrants in the United States, there are more undocumented Canadian immigrants than undocumented Mexican immigrants. But it's very telling which border has the border wall and the concentration camps in practice. There is, of course, a lot of racism tied up with that xenophobia. We also see across the board worldwide, but especially in the United States, this really intense stigma against mental illnesses and people with intellectual and developmental disabilities, and a rejection of people who have sensory disabilities and epilepsy, so people who are deaf, people who are blind, people with different seizure disorders. Throughout US history, all of these different groups and populations have been targeted by eugenics practices and even for genocide. So across the earth, discrimination is a huge issue in a lot of different forms. Eugenics is just one way that discrimination can be or can come about, but there are so many examples of discrimination, so many examples of eugenics. I'm sure you all can think of other examples that I haven't discussed here today. A couple other examples of discrimination as a health-related issue. We do see that disabled women have the highest rate of sexual assault out of any population. They are 3 times more likely to be sexually assaulted than non-disabled women, and particularly women with developmental disabilities have a 90% chance of being sexually assaulted in their lifetime. The reasons for this are vast and complex, but we do see a victimization of this population at a higher rate for a variety of reasons. One reason being that a lot of disabled women may have caretakers or people that they rely on in medical or home settings who they're just in a very vulnerable position with these individuals. And so if an individual were to take advantage of that person, of course, that is a situation where that just chance is a little bit higher because of the nature of those relationships. We do also see that a lot of non-disabled women and disabled people, or sorry, a lot of disabled women or disabled people in general are stereotyped as being, and excuse my language here, but this is a term straight from medical sociology, but unfuckable. The idea that disabled people are not capable of or should not be interested in or should not be having sexual encounters. That kind of belief leads to people not reporting it when it does happen to them. And a lot of people who do report it are met with this misunderstanding that perhaps they would have enjoyed that encounter of sexual assault because they would have never had that kind of experience otherwise. Of course, that is a gross misunderstanding of what that circumstance actually is, but we see discrimination both in a misogynistic way and in an ableist way affecting this population of disabled women in a way that is very violent, is very discriminatory, and is extremely problematic worldwide. We also see that disabled people across the entire world have high rates of poverty. In the United States alone, over a quarter, so over 1 in 4 disabled people live below the poverty line. That is, of course, also due to discrimination. It's due to a long history of eugenics and disenfranchisement, and today employment discrimination, as well as enforced poverty on the part of Social Security and disability benefits, those benefits being very, very minimal, definitely not something that a person can live independently off of. And so a lot of disabled people are living with these really high rates of poverty, living in very disenfranchised, very oppressed kinds of situations. And that is, of course, a global health issue because all disabled people are facing these kinds of barriers. Again, 1 in 5 people has a disability, so if 20% of the world population is facing these barriers, that is quite clearly a global health issue. Summing up with a few other examples of how ableism and abuse and mistreatment are relevant to global health issues or to this discussion of discrimination. Again, Social Security and disability benefits in the United States pay very little. We do see marriage restrictions and marriage inequality for the disabled population, as well as income and wealth restrictions for Social Security recipients. We also know that a lot of residential care homes have very poor practices, and there are a lot of institutions that are actively abusing their residents. Particularly in autism treatment, we see the use of things like prone restraints on autistic people and even children. Um, a prone restraint being holding someone's hands behind their back and pressing their face, chest, and neck into the ground. That can be fatal for individuals. That can lead to suffocation. And so residential care homes that are using these kinds of practices are in some cases killing their residents. In some cases, we probably shouldn't even call those people residents, and we should probably call them inmates in these situations. And so in the places that this is happening, in places where mental health is stigmatized and disability is stigmatized, which is an issue worldwide, we're seeing that mistreatment affect this population at a really, really large scale. Finally, worldwide, we have a very inaccessible built environment for disabled people in the United States and just all over the place. Wheelchair users have a really hard time accessing a lot of different buildings, resources, and recreation spaces. And for people with sensory disabilities, such as hard of hearing or deaf people, the lack of closed captions on a lot of content, and the lack of things like Braille menus for blind or vision impaired individuals also creates an inaccessible environment and contributes to a lot of potential distress and further health issues. So across the board, discrimination creates a host, just an absolutely unending list of potential problems, health issues, hardship, trauma, morbidity, mortality, deaths. Um, this is perhaps one of the largest health issues that we're seeing globally that is um, largely understood in a fragmented way. And if we look at the issue of discrimination on a large scale and as a global issue, then we really do see how fixing discrimination and working against discrimination and these kinds of, racist and sexist and discriminatory kinds of practices could make a huge, huge dent in the global health issues, global inequalities as far as illness and disability, and would really just make a huge difference in the overall health of humanity. So thank you all for being here this week. I will see you again next week for week 13.